to clarify the nail changes in some common dermatological disorders. We have an example of some dermatological disorder, and we recognize what are these nail changes. Number 3 is to recognize nail disorders associated with some systemic diseases and to identify what are the traumatic nail disorders, and finally to have an idea about nail tumors.
دكتورة العفو بس الصوت بعده بشوية وشة.
بوشة؟
اي
اوكي
دكتورة.
تمام. ده ثواني.
الو، تسمعوني؟ هل
اي
الصوت
دكتورة
افضل؟
هسه صار زين.
صار زين؟ اوضح الصوت؟
اي دكتورة.
تمام، يلا اوكي. اذا اكو عندكم اي خلل همينة قولوا لي. We return now to our lecture about nail disorders. First of all, who can tell me what are the characteristics of normal nail? يعني كل واحد يباوع عصفرة ويقول لي what are the characteristics of normal nail? First of all, the normal nail should be shiny, should be firm, color light pink in color, okay? There's no pits, no roughness, يكون surface smooth, okay? These are the characteristics of normal nail. And everybody can look to his finger, his nails. نشوف bright pink in color, shiny, smooth surface, there is no pits, no spots. Okay. Now we'll start the first section about nail disorder associated with skin disease. We'll take an example, psoriasis. As you know, psoriasis is a common disease. There is nail involvement in psoriasis. The nail involvement is common. Really, we can find it in 50% of cases. Changes are usually involve the fingernails bilaterally, symmetrical. الصورة واضحة أمامكم؟ بدها تطلع؟ لو
دكتورة
واضحة.
بعد على characteristics of normal healthy nail.
Okay. Wait a minute. هسه
اي دكتورة هسه.
Okay. نرجع. The common nail finding in psoriasis, the commonest one is nail pitting. Nail pitting means there's small pits found on the nail, okay, surface. These pits usually are large, irregular distributed, okay, and they usually are superficially large and irregularly distributed. These are the nail pitting. Second nail finding, we can find onycholysis, which means separation of the nail bed nail plate from the nail bed. Is there separation? Okay, as the separation, you can see this color, the yellowish discoloration of the nail, which represent there is the separation between the nail bed and nail plate. Oil drop sign, which is characteristic for psoriasis, we can find the orange spots found in the nail plate. Other findings include sublingual hyperkeratosis and nail plate ulceration, and also we can find splintal hemorrhage. Usually splintal hemorrhage, we can find it at the distal part of the nail plate. Treatment of nail psoriasis usually is difficult. There is many modalities. From one of them is intralesional corticosteroid, topical 5-fluorouracil, PUVA, means losing of light therapy, systemic corticosteroids, systemic retinoids, or even MTX or methotrexate, and cyclosporins, but usually the treatment is difficult. Other dermatological disease, we'll have an example about lichen planus. Nail involvement represents 10% of patients with lichen planus. The commonest change include onychorexis, which means longitudinal ridging and fissuring of the nail plate. We can find longitudinal ridging and fissuring, striation. This is called onychorexis. Thinning of the nail plate, Petriedium, which is adhesion of the proximal nail fold with the nail plate. Nail dystrophy, shedding of the nail plate, splitting also could be found. Treatment also we can use intralesional corticosteroid, systemic corticosteroid, systemic retinoids. Okay, but also the results are equivocal. Dermatitis. Dermatitis, usually we have a picture of chronic hand dermatitis, which also affect the finger. From these nail changes, we have nail pitting, both line, roughness of the nail surface, discoloration of the nail, onycholysis, sublingual hyperkeratosis, and chronic paronychia, which means inflammation of the lateral and proximal nail folds. So we can see in this picture, we have the both line, which are transverse grooving on the nail plate, which represent the cessation of growth at a specific time, and then we can find this striation on the nail plate. Pitting, as we said, shallow depressions on the nail plate. Also, they are irregular distributed, wide, and deep. And here we have a picture of chronic paronychia with onycholysis and hand dermatitis, chronic hand dermatitis. Our last example is alopecia areata. Here, alopecia areata, we have changes from 20 to 50% of patients, and usually more obvious in children than in adults. From these changes include geometric pitting. Here, the pitting usually differs from the pitting of psoriasis and dermatitis. Usually, they are small, very superficial, and regularly distributed. There, in psoriasis, it was irregular distributed. It was wide and usually deep. Here, we had superficial pitting, regularly distributed, and they are shallow or superficial. Also, we have surface stippling, we have nail dystrophy can be founded, trachonychia, which is due to destruction of the nail surface. We can feel it as a sandpaper-like. We call it trachonychia. It's commonly found in alopecia areata, punctate leuconychia, which means discoloration, whitish discoloration of the nail plate. This now we start in section 2, which is nail infection. Common nail infection, we have an example, bacterial infection. Here the condition we call it paronychia. Paronychia is a swelling or inflammation of the proximal and lateral nail folds. Usually it's the most common hand infection, usually divided into acute and chronic. Acute paronychia, there is severe pain, tenderness, swelling found in the lateral nerve folds and even the proximal nail fold. There's redness and usually pus collection. Commonest microorganism is Staphylococcus aureus. Also, streptococcal could be found. Can occur spontaneously or after trauma. Could involve the fingernail or toenails. Usually it's a common nail infection. Treatment, if it's very inflamed and there's superficial infection and inflammation, severe tenderness, and there's a huge amount of pus, we can make a small incision, drain the area. Okay, but if it was deep, okay, we can use all these systemic antibiotics. Anti-staph. Chronic paronychia. Chronic paronychia, as we mentioned before earlier, we said that it's a picture of hand dermatitis, eczema. Okay, remember that chronic paronychia could be a complication of chronic hand dermatitis or eczema due to repeated exposure to moisture, water, chemicals, detergents, like housewives, bakers, dishwashers, okay, diabetic patients. Here there is mild tenderness. Usually there is little redness, a little swelling, swelling, but there is no tenderness, pus collection or inflammation as in acute paronychia. Just we can found loss of the cuticle, nail surface abnormalities and alteration, roughness, okay, and the nail surface, with loss of cuticle and swelling of the nail folds. Usually, many or all finger may be involved. Usually, it's a mixed bacterial gram-positive or gram-negative and candidal infection as a complication, as we said, from dermatitis. Treatment usually try to keep the hands dry. Means when you wash your hand, the patient have to dry his hand immediately. Use usually topical antibiotics, antimalarials, oral antibiotics when tenderness and redness are present. In chronic condition, we have mixture of antibiotics, antifungals, topical steroids. Okay, we can use moisturizing emollients also are important. For resistant cases, we can use cryotherapy or even surgery. Nail avulsion, I mean. Number 3, as an example of infection, is Pseudomonas nail infection, green nail, Pseudomonas nail infection. Due to repeated exposure also on detergents and water can occur as a complication of onycholysis. As we said, onycholysis are separation of the nail plate from the nail fold, from the nail bed, separation of the nail plate from the nail bed. So there will be an area, space between these two layers, the nail plate and the nail bed. This space will be is a good area for colonization of infection because there is humidity, water, moist, so it will help for growth of infection. From this infection, as we said, bacterial infection could be a Pseudomonas infection. Okay, it will be if Pseudomonas infection, this is the color of Pseudomonas infection, which is a green color. In semi-green nail, the nail plate has a characteristic bluish, black, or green discoloration. Treatment use of antibiotics and sulfa drops. And as an example of That was a bacterial infection. Now we start a viral infection. As an example of viral infection, we have a herpes simplex virus infection. It is could occur as a primary inoculation of herpes simplex virus, a condition we call herpetic whitlow, characterized by a group of vesicles or small blisters found on the nail or around the nail bed. Okay, it is common in dentists, nurse, patient present with tenderness and redness with vesicles on the finger or on the side. treatment طبعا start anti cyclovir. Fungal infection, we have tinea of the nail. Fungal infection we called onychomycosis. Onycho means nail. Onychomycosis, fungal infection. Tinea unguam usually due to Trichophyton rubrum or Trichophyton mentigraphase, but can be due other non-pathogenic fungi, affect toenails and fingernails. Usually are asymmetrical, painless could be also varies يعني الpain tenderness, but usually it's painless. There is thick, easily cramped, brownish colored nail with onycholysis also. Usually it starts at the free edges of the nail, at the distal part. Start at the distal part. We have three clinical presentation. Distal subungual onychomycosis, this is the commonest presentation. Proximal subungual onychomycosis and white superficial onychomycosis. This occur in patient which is immunocompromised, as example in HIV patient. Treatment, we start oral antifungal drugs like fluconazole, itraconazole, terbinafine. طبعا treatment according to the nail يعني the nail infection عندنا we need to continue treatment regimes for يعني duration from 6 weeks to 3 months. Resistant cases, we have nail avulsion could be done. Candidal nail infection. Due to Candidal albicans, mostly in patients with chronic mucocutaneous candidiasis, it could involve all the fingernails where the nail plate usually is thickened and have a yellowish brown discoloration. The infection usually starts from the proximal end of the nail, okay, from the nail matrix in mucocutaneous candidiasis. Treatment by systemic antimalarial drugs as triazole and terbinafine. Our third section today is traumatic nail disorder. At first, the first example is onycholysis, which, as we said, painless separation of the nail plate from the nail bed, causes either primary, which is idiopathic, or secondary to other conditions. Example, as we said, psoriasis, dermatitis, onychomycosis, medical condition, hyperthyroidism, yellowish nail syndrome or yellow nail syndrome, which is cessation of nail plate growth. There will be no nail growth and with over curvature or curved nail, okay? with cessation of growth فيكون الcolor of the nail is yellow فيسموه yellow nail syndrome, affect all the finger and toenails. Impaired peripheral circulation also can lead to yellowish discoloration. To onycholysis. Traumatic nail, as in prolonged immersion in water, use of chemical and nail cosmetics. Also, all these can lead, يعني manicure care of the nails and like that, all can lead to traumatic onycholysis. We have hereditary condition and some drugs. Example could lead to photoonycholysis as tetracycline, psoralen, and fluoroquinolone. Nail biting is a nervous habit usually begins in childhood and lasts for several years. One or all nails may be chewed and extend as far as the annuli, leading to destruction of the nail plate. See the nail at different levels. Okay, destruction in annuli will skin around the nail, usually with distal or lateral nail folds. Ingramming of the nail, onychocryptosis. It's a common traumatic problem, usually affect the large toe, caused by lateral pressure of the ill-fitted shoes, okay, to the nail folds, the lateral nail folds, leading to improper or excess. From these common causes are ill-fitted shoes, improper or excessive trimming of the lateral nail plate, or trauma. Usually the nail pierces the lateral nail fold, causing pain and swelling at that area. And also as a consequence of penetration of the nail and chronicity, the area become purulent, edematous, growth of exuberant granulation tissue. Treatment: the patient have to cut the nail in a proper way, wear wide shoes, treat any infection if present. In resistant cases, we have surgical removal of the lateral nail fold, and it means partial nail avulsion, or we can lead finally to complete nail avulsion if there is no improvement. Petriedium, which is adhesion of the proximal nail fold to the nail bed, caused commonly in lichen planus. Other causes are severe trauma such as burn, wart in the nail matrix. Poor blood circulation disorder could lead also to petridium. Subungual hematoma, trauma to the nail plate, lead to accumulation of blood beneath the nail plate, leading to pain and black discoloration of the nail. Nail hypertrophy or onychogryphosis. Gryphosis means thickness, thick. Here we have thick nail, thick, hard, yellowish brown, twisted nail plate. Occur in repeated trauma, can also occur in psoriasis and fungal infection, seen in elderly, neglected patient also. Okay. Leukonychia. Leukonychia means white nail. Here we have white spotted or bands. Leukonychia. It's either congenital or acquired, present in four patterns: either total leukonychia, all the nail plate is white, or partial leukonychia. Could also present striated as a transverse striates, or punctate leukonychia. May be related to trauma or to other systemic disease, or there is unknown cause. Malnutrition also is a common cause of leukonychia. Hepatic deformity. Hepatic deformity is common finding caused by repetitive biting or repetitive rubbing. Okay, friction. We have picking a section of the proximal nail fold of the thumb with the index finger. You rub his index fingernail with the thumbnail. Rubbing or friction, surface of the nail with the other nail, with the index nail. Okay. طبعا lead to destruction of the lanulae and lead to nail plate alteration as shown in the picture here. Our fourth section today is nail and internal disease. As an example, we have Bowline. Bowline is a transverse depression of the nail plate, appears weeks after a stressful event, which temporarily interrupt nail formation. I mean, there is cessation of the nail growth. Cessation, temporal cessation. Okay, due to a stressful event, as trauma, as high fever, as other infection, pneumonia, measles, mumps, systemic diseases, certain medication, all these lead to a temporal cessation of growth. Okay, this cessation will not appear at the time of the event, but usually weeks or months after that event. Weeks or even months, 2 to 3 months after this stressful condition. Cholinicia spoon nail found in iron deficiency anemia and idiopathic hemochromatosis, clubbing of the nail. Either we have primary cause, which is idiopathic, familial, or secondary to other disorders uh, as pulmonary disease, lung cancer, cystic fibrosis, cardiac disease. We have also GIT disease, inflammatory bowel disease, etc. as shown. Splintal hemorrhage as trauma, acute trauma, acute bacterial endocarditis, mitral stenosis, rheumatoid arthritis, hypertension, malignancy. We can find this longitudinal splintal hemorrhage. Apparently conychia. Here, apparently conychia means white discoloration of the nail plate that fade with pressure. It's usually due to nail bed edema, not due to change in the color. We have edema of the nail bed, okay, and it's obvious that the nail will become white. We have three different types, either tourist nail, murex nail, and half nail. Tourist nail, it is a white or light pink nail plate except for the 1 to 2 millimeter distally. فنشوف الديستال باند يكون اللي هو يكون normal color, and the nail plate from the proximal part all become white. Okay, seen commonly in liver cirrhosis, chronic congestive heart failure, adult onset diabetes, hyperthyroidism, and could be common finding in aging. Murex nail, multiple transverse whitish bands parallel to the lanuli, seen in patients with hypoalbuminemia as in nephrotic syndrome, and also is a very common finding after chemotherapy. Half and half nail, seen proximal white and distal red nail. Discoloration usually occurs in patients with chronic renal failure. Nail discoloration due to color changes in the nail plate or in the nail bed can be due to staining from external source as dyes, nail polish, which paint the nail also, or degenerative changes as well-grown nail due to slowly growing nail as in old people or in yellowish nail syndrome, partial nail destruction after formation, drugs like tetracycline could cause yellow nail, blue nail and mipachlorine chloroquines also cause a bluish black nail, L-argyria cause bluish nail, FD eruption of the nail bed in phenolphthalein, arsenic poisoning is common, found a condition, white spots in the nail, condition called meseline or mese strips. We can find it in arsenic poisoning. Okay. Also, other discoloration we can find longitudinal brown nail, which it is due to increased melanin production from the nail matrix melanocytes. We can find it in Addison disease, in pigmented races, Africans, junctional nevus of the nail matrix, breast cancer, melanoma of the nail, periangual pigmentation is a condition known as Hutchinson sign, and trauma. Tumors of the nail, we have benign tumors such as wart, periangual wart, fibrokeratoma, melanostic nevi, benign melanostic nevi, subangual exostosis, myxoid cyst in the nail bed, Pyogenic granuloma. Sorry, nail matrix myxocyst, not nail bed. Pyogenic granuloma, PG, which is a vascular tumor, could after trauma could find anywhere, but if the trauma involved the nail matrix or the nail bed, could cause development of pyogenic granuloma. Glomus tumor, the nail bed, and glomus tumor of the nail plate. Other example of malignant nail tumors, we have squamous cell carcinoma, which present with hyperkeratotic destruction of the nail plate. We can find erosion, fissuring, maceration of the cuticle, and erythema of the cuticle and nail bed. Malignant melanoma, 75% of cases with present with longitudinal melanocyte, longitudinal melanocyte. Also could represent as a brown or black discoloration of the nail plate, and also as a destruction of the nail plate. Usually in longitudinal melanocyte, the pigmentation becomes darker and broader and at the free edges. Okay. As we mentioned before, Hutchinson sign means brown, black, periangual pigmentation. طبعا عادة هو الميلانيكي يصير at the single digit. Okay. Anyone have a question? أحد عنده سؤال يتفضل. أحد عنده سؤال؟ هذا example, what nail polish can affect the skin and nail? The side effects of nail polish. Contact dermatitis, usually eyelid contact dermatitis. Okay, it's a common nail finding. So in the nail plate staining, change the color of the normal color of the nail plate. This is nail yellowish orange in color. And destruction from repetitive use of acetones can lead to excessive dryness of the nail plate, dermatitis, brittle nails. Okay, inflammation of the nail folds. هذا هيجي بس سلايد نبين بين nail polish side effects. Okay. لهنا we finished our lecture today, which is about nail disorders. The summary, أخذنا nail disorders associated with some dermatological disorder, as an example psoriasis, lichen planus, dermatitis, alopecia areata. Number 2, we have nail infection. We had an example as bacterial, fungal, and viral nail infection. Third section was traumatic nail disorder. We have the common trauma as hematoma, ingrowing nail, nail biting, onycholysis. Our fourth section was nail associated with systemic disorders. An example, booze line, يعني some nail findings, booze line, ليكونيكيا والكولينيكيا. Other problems associated with the nail was nail discoloration. And finally, we had an idea about the benign and malignant tumors that can affect the nail unit. Okay, till here we end our lecture today. اللي عنده سؤال يقدر يسأل، واللي ما عنده سؤال he's free to go.